Good morning, everyone. My name is Alicia Turner, and I'm here to teach you guys about test taking strategies 101 to get you all ready for test taking tips for Nursing 3. All right, so some things that we're going to cover. We want to look at some key concepts. Some things that you all should do and should be doing is read the question carefully to determine what key concepts you should be looking at. So what are we doing? We want to look at who is the client, what is the problem, what is being asked, and what is the time frame. So you want to look for keywords. Look for words that focus on the issue. Either it's early or late, most or least likely to occur. These are words that are easily missed, and sometimes if you're not practicing looking for them, sometimes you guys kind of like glaze over those words. And we kind of help you all because we bold them for you. So look for the initial nursing action. This means the first thing you will do as a nurse. Think of the first step in the nursing process, which is assessment. You will assess first before intervening. So how do you know what you need to do unless you assess the situation first? Essential questions. When the question asks what is essential, think safety and precautions of the seriousness of the complication. Essential means that you must do it and it cannot be left undone. When setting priorities, remember of Maslow's hierarchy of needs. The first level needs to come first. Remember, keep them breathing, keep them safe. If they're not breathing, are they alive? Keep them safe. And I've always told y'all, when I go to work, my 12 hours, I want to keep them alive. I want to keep them breathing until I clock out. That is my ultimate goal when I clock in. Keep them alive, keep them breathing, keep them safe. Also consider what action that prevents the complications. These are essentials that you must do to keep the patient safe. All right? If I know my patient is a fall risk and they like to jump about the bed, guess what? I'm going to be making more frequent rounds. If I know my patient has issues where they have urgency and they have to always go to the bathroom, I'm going to make more frequent rounds and make sure they have to go to the bathroom. I'm going to help them up and go to the bathroom. I'm going to make sure that I have the bed along on them at all times. If I know for a fact they may need a sitter, I may need to find out, hey, can the family come sit with them? Or maybe I need to sit in the room with them. Maybe I need to make some type of intervention to make sure I keep my patients safe at all times. Because the last thing you want them to do is to fall and hurt themselves. The odd man wins. The option that is most different in length, style, or content is usually probably the one that's correct. The correct answer is often either the shortest or maybe even the longest. If there are two or three answers at the same time, think the different words that they all can't be correct. Now, some of you all, y'all have taken my test. I may have three, maybe four, maybe all of the answers have the same thing, but it's always going to be one thing that's in there that's different. That means that you have to definitely know the content to know which one is the correct answer. Because all of them may be the same, all of them may not, but you got to know something. Just like for this example, poor appetite and anorexia are the examples. Now, anorexia, you may think of a person that may be bulimic, but we use anorexia in oncology too, and anorexia is also can be used for poor appetite for our cancer patients. So you got to kind of like know the contents and know the context of how it's being used. All right, opposites. When two answers are opposites, such as hypotension and hypertension, the answer is usually one of the two. So this is a question that's an example. An adult is admitted in with shock. Which assessment findings would you expect to find? All right. So slow pulse and flush color. All right, those are your two distractors. We can go ahead and knock them out. So you pretty much have to know what shock is. You having a brain fart, you've been cramming all night, which you should not have done. So let's go back to your two things that you should know from nursing 2, because we're in nursing 3. What is hypotension and what is hypertension? What does it look like? What does it manifest in your patient? So what is hypotension and what is hypertension? And if you kind of like know what hypotension and hypertension manifested in a patient, then you should have known and should know that the answer is B, low blood pressure. Absolutes make answers wrong. There is no such thing as absolutes. There's no such thing as always, never, all, none, always, sometimes, frequently, often. There is no such thing because nothing is always, nothing is never, nothing is all, nothing is none, nothing is sometimes, nothing is frequent. So if you have an answer that has that in it, that is a distractor, mark it off. That is not the correct answer. You shouldn't even be thinking that that's an answer. If you see something that says never, always, sometimes, usually, frequently, maybe, that's not it. Mark it off. That's a distractor. That is not even an answer. That even should even be in your vocabulary. That is incorrect. So that should be automatically distracted. Go ahead and mark it out. That is not even the correct. Once again, always read your questions to the end. Sometimes our brain moves faster than our eyes. I've talked to some of my people in the Connect group, and they're like, oh my God, Ms. Turner, I was reading that, and my brain said it was this, and I picked that answer, and I didn't read the rest of my question. Well, guess what? I'm going to need you to stop doing that. I need you to read the question in its entirety because it can be one keyword that can throw you completely off and make you pick the incorrect answer. You got to stop, and you have to pace yourself and read the question in its entirety. If the answer does not still appear obvious, eliminate the answers that cannot be correct. But you have to read the question in its entirety first in order to do that. Remember, the answer must relate to the question. If it does not relate to the question, then the answer is incorrect. If you do not know the answer, make an educated guess and then move on. If you spend so much time bogged down on one question, you're going to make yourself anxious, and when you make yourself anxious, you're going to get yourself worked up, and then you get yourself worked up, and then you're going to spend too much time, and then everything that you do know, you're going to mess up, and you're not going to do good on the test because of one answer. Just make an educated guess and move on. And most of the time, once you get through a couple more questions and you get more relaxed, then you're going to remember, like, oh, that's what that answer was, and then you're going to be able to go back and you answer that question correctly. So just don't get bogged down on that one question. Avoid what if. Don't read too much into the question. Some of you guys get like, what if this, what if that? You are not doctors. You are not astronaut scientists. You're not neurologists. You're not going to get a PhD in nursing, not just yet. So do not get bogged down in the what if. When you become a nurse, you're going to be considered a novice nurse. State Board just wants to know that you are a safe nurse. They know that you all do not know everything. And I have told you guys, the ones that have known me, if you wake up one morning and you feel like that you are an expert in nursing, please go find you something else to do. Because at that point, you are considered a dangerous nurse. Because nursing is ever learning. You are going to continue to learn every day. If you wake up and you feel like you know everything about nursing, find you something else to do. You are a dangerous nurse, and I do not want you operating on me and nobody else in my family. And I'm just going to be completely honest. You have to continue learning nursing. There's no such thing as you know everything about nursing. I learn new things about nursing every day, and that is the beauty about nursing, because I feel it's so wide open and you want to learn something new every day. But do not get bogged down in the what ifs. Do not get bogged down in the weeds, because you will drive yourself crazy and you will mess up on this test. Take it at face value. If you know the content and you know the material, you can answer the question. All right? Do not get bogged down in the weeds. Focus on the information. Focus on the question. Read every word. Look for the strategic words. Always use the process of elimination, and determine if the question is a positive or a negative. All right? Like I said, closed-ended words, all, must, only, never. We talked about that. If you see it, it's incorrect. And you see, I've talked about this twice. So that means that it's very important. If you see these words, process of elimination, just knock it out. It's not important. It is wrong. If you see it in your answer, it is incorrect. That is a negative. That answer is incorrect. Mark it through. It is wrong. That is a distractor. Use guidelines for delegation. You guys are about to be RNs. That is what we do as RNs. We delegate. You have to know what you're delegating, and you have to delegate the correct task to the right individual. It's very important. Always think about the job description and the role of the employee, what you're going to do. You're not going to delegate your PCA to go down there and start an IB. You're not going to delegate your PCA to go down there and put a Foley catheter in. However, some facilities do train their PCAs and their CNA to do different things, but that's based on those facilities. But you have to go by what the policies and procedures are of your job. But for board purposes, you will not be delegating a PCA to do that, okay? So just think about that. Do not go by what your job does. Go by what the State Board of Nursing say that you can do, all right? A lot of you all work for facilities, and you answer your test based on what you do in the real world. Do not do that. And some of you all, I'm going to slap your hands. I'm just telling you now. Do not do what you do on your job. That's going to hurt you. Go by what state boards say you can do as a new novice nurse. You got to delegate based off what they can do. Remember to match the client's needs based off the scope of the practice of the healthcare provider. That is the key. Someone needing tube feeding and a dressing change has to be licensed. Have to be licensed. Pharmacology questions. Like I said, this semester we're med-surg heavy, we're drug heavy. So if you're learning cardiac with Dr. Cox, you better believe you need to know those drugs. You're learning endocrine with me or any of my content psych, you need to know the drugs. Once again, most of these medications cause nausea, vomiting, diarrhea, constipation. I don't care nothing about that. We don't care nothing about that. It's all about patient teaching. What is something that you need to be teaching that patient? Safety. Remember, we need to keep them alive, breathing, safety. Safety is the key. Now, granted, if that's all the medication causes, nausea, vomiting, diarrhea, constipation, then yeah, that's all you can tell us. But if it's something saying that they can have palpitation, heart rhythms, AFib, something like that, don't you think that's something important that you need to be telling me, something that you need to be telling Dr. Cox, something that you need to be telling whoever's teaching you the content, especially the patient? That is something that's the warranted importance that you need to know. You need to know the drugs by classification. If you know the class, and if you know the generic, and you know the trade name of the medications, you will be fine. But you need to know the action and the side effects of the medications, especially when you go to clinicals, because if you go to clinicals with me, you're going to know these things, and you have to know these things before you can go past medications. And you will not have your drug cards. When you have this, you need to be able to run all these things off to me before we go past medication, because I need to know that you're safe enough to give this medication and to teach this patient when we go in the room. Because the worst thing you want to do is go in the room and be able to give that patient medicine, and they ask you, what are you giving me? And you can't tell them, because I'm going to be looking at you and you're going to be looking at me. And if I have to tell the patient why they're taking the medication, then you're going to get a use for medication administration on that day, because you were not ready to pass medication. So it's very important that you know why you're giving the medication and what side effects that you're going to be teaching your patient about the medication. And you need to go ahead and start drilling that in your head now, especially for test purposes, because that's very, very important. Because remember, guys, you all are the ones who are going to be giving this medication, and you got to know why you're giving the medication and the mechanisms of what you're doing and why you're doing it. And so that is very important, and that's what we're doing here for test-taking strategies, for us learning about medications, how to take the test, how we're going to get you ready for our test. As long as you're reading and you're studying and you're prepping and you're getting yourself together, you will do fine in Nursing 3. Make your appointments with us, go to past class, get with Ms. Bridges, get with us, and we're going to have an awesome semester in Nursing 3. And I can't wait to see you guys in class.